So actually being at AES this year reminded me of the opportunity that I had to interact with Brandy. Brandy and I met through Cynthia Harden, a mutual friend. And one of the things that I did after meeting Brandy was I wanted to learn more about my epilepsy story. And the more that I learned, I picked up on the passion that Brandy has for this organization, certainly the passion that she has for caring with women and girls with epilepsy. And I really think that it's important to take that passion, and I wanted to be part of it because she was doing a lot of great things for women and girls with epilepsy. So certainly as a firm believer in interprofessional care, I think that all of the providers that can bring their strengths to the care of the woman with epilepsy is key. We do not practice in a vacuum. We practice with our colleagues. I work with nurse practitioners, work with epilepsy docs, work with social workers. I think that there's a lot each of us can provide to patients with epilepsy, let alone women with epilepsy. I work pretty closely with our high-risk OB clinic and the maternal fetal medicine docs to really expand our care to pregnant women and talk to them about what role that pharmacists and all the members of the team can play. So I think interprofessional care is key for all patients, let alone women with epilepsy. So as a pharmacist, I'm a little bit biased, but I think that pharmacists can play a large role, a key role on the interprofessional care team. Certainly as the drug experts, and because drugs are the mainstay of therapy for patients with epilepsy, I think that we can provide a lot. Drug interactions, adherence, side effect monitoring, efficacy of drugs. I think that our knowledge allows us to contribute a lot to the care of the patient, and also to enhance the knowledge and learn with and about from other professionals. The other thing that's important is that pharmacists are the most accessible profession, and so women with epilepsy can interact with a pharmacist by going to their community pharmacy and asking questions, learning, really providing, the pharmacists are in an ideal position to provide care. So as I mentioned before, the model that we use at Ohio State is one where I work alongside our epilepsy docs, our nurse practitioners, other providers, to really enhance the care of patients with epilepsy. For example, last Wednesday I was in clinic. So in clinic I was going in to interview the patient, find out how that patient had been doing since the last time they were in clinic, getting an update, asking them questions about their medication use, side effect monitoring, adherence, looking and scanning for drug interactions, looking at efficacy of drugs, and then coming up with a to-do list or a plan. I then would go out and tell the nurse practitioner that I was ready. We would do the handoff in the room, talk about the patient in front of the patient, so that if I got anything wrong or they had anything to add, then clearly we could do that. In our clinic, half of our patients are women, so what our knowledge allows us to do for all patients, but especially women with epilepsy, I think is a good model. We also use the model where we provide care from a distance right now through electronic health record for our high-risk OB clinic through the maternal fetal medicine docs, consult with them about the care of their pregnant patients and patients who are consulting on maybe what should happen pre-pregnancy.